we might still have some people popping in, but we will go ahead and get started. Hopefully everybody can hear me all right. If you cannot hear me or the volume is too low, just let me know. You can either unmute yourself and let me know, or again, you can type into the chat box. Hopefully everybody got the email that I sent earlier this afternoon that included a copy of the slides to follow along with this PowerPoint, as well as the handouts that I will be referencing during the PowerPoint. If there are any questions, I will be pausing at different parts of this presentation to take questions. Questions can be, again, either typed into the chat box at any time and I will address them at the pause, or again, you can unmute yourself and just simply ask the question live. I think that's all the housekeeping items, so let's go ahead and get started. Good evening, my name is Roma. I am with the Area Agency on Aging in the Pikes Peak region, and you are attending Medicare 1. This is part 2 of a 4-part series. And welcome. Thank you for joining us tonight. We appreciate your attendance, and hopefully we will learn something. So again, I am with the Pikes Peak Area Agency on Aging, which is part of the Pikes Peak Area Council of Governments. And the mission of the Area Agency on Aging is to work with other communities and towns and cities in our 3-county region to coordinate and develop programs and systems that remove barriers to keeping people able to live independent in the Area Agency on Aging serves El Paso, Park, and Teller counties in our region. Specifically, I am the SHIP coordinator for our region. The SHIP program, which is a federally funded program, is the State Health Insurance Assistance Program, which is a program designed specifically and solely to provide unbiased education and information about Medicare and anything possibly related to Medicare. The SHIP program through the Area Agency on Aging actually serves 9 counties of Colorado. I've listed the counties on the slide. We can be reached either at our local number here in Colorado Springs, and I've also provided the toll-free statewide number. By calling the toll-free statewide number, you would be routed to the SHIP office closest to wherever you're calling from. There is a SHIP office available at least by toll-free number in every state of the country. So there's a SHIP program designated for every county and every state to provide free and unbiased Medicare information and education. A quick review of last week's part 1. Last week, we talked about Medicare enrollment and eligibility and benefits. We talked about Medicare Part A. We talked about Medicare Part B, what it costs, what it covers, etc. I did want to make a note, brought to my attention earlier today that the slides last week, I had indicated what Medicare Part B services are covered. And I indicated that the shingles vaccine was covered by Part B. And what I did not do was elaborate on that information by suggesting that Medicare Part B does not cover the shingles vaccine itself. It pays for the administration of the vaccine. So it pays for the person to actually inject the vaccine into your arm. Part D would cover medication itself. So it's kind of a 2-part benefit. Part D covers the actual vaccine. Part B covers the person who injects you with the vaccine. I just wanted to clarify that so there was no misunderstanding. And again, I appreciate the person who brought that to my attention for not having clarified that last week. So I just wanted to make a note of that before we got started. So this week, we are going to be talking about your options to go with Medicare. So at this point, we're assuming that you have Medicare, you've enrolled in Medicare Part A and Medicare Part B. And now we're going to talk about the 2 primary options available for most people. for coverage to go with Medicare Part A and Part B. And we're going to talk about two specific types of coverage: Medicare Supplements, also known as Medigap coverage. And we're going to talk about Medicare Advantage Plans, also sometimes referred to as Medicare. For both of these options, you do have to have original Medicare A and B. You have to be enrolled in both A and B to be eligible to enroll in either a supplement or an advantage plan. Both kinds of options are regulated by Medicare and the divisions of insurance in the state that you live in. And there are limited enrollment periods in order to be able to get these options. We are going to talk about Medicare Supplements, also known as Medigap first. Medicare Supplements or Medigaps and Medicare Advantage Plans or Medicare Part C are two entirely different animals, two entirely different kinds of insurance. So we are going to talk about Medicare Supplements first. I tend to refer to this kind of coverage as a supplement versus a Medigap, simply because I've been doing this for a really long time, and Medigap is a newer, more fandangled term that has come into use just more recently. So what is a Medigap or Medicare supplement? Basically, Medicare supplement insurance is a private health insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to supplement or pay the balance that Medicare Part A and Medicare Part B left over after they paid their part first, period. Let me say that again. Medicare supplement insurance is a private policy you purchase from a private company, private insurance company, and is solely and specifically designed to pay the balance that Medicare Part A and Medicare Part B left over after they paid their part first, period. What that means is Medicare supplements are designed to pay any balance that Medicare A and B left over after they paid first, and that's all it does. All Medicare supplements have to follow both federal and state laws that are designed to protect you, the beneficiary. Medicare supplement insurance policies must say on the policy itself, Medicare supplement insurance. Those three words in that order must be written on the policy itself for it to be a legitimate policy. The phrase Medigap comes from the thought process that this kind of coverage covers the gaps in your original Medicare, i.e. the out-of-pocket costs that Medicare doesn't cover. Medicare supplements are standardized. And what that means is there are a limited number of levels of coverage, and those levels of coverage are set in stone, regardless of who you buy a policy from, with the exception of 3 states, Massachusetts, Minnesota, and Wisconsin, who have some additional options available in those areas. Medicare supplement insurance costs can vary in premium, will vary by the plan level that you choose, will vary by the company that you choose to enroll with. It can vary by zip code. It can vary by whether you're male or female. It can vary by whether you are a smoker or non-smoker. So there are a lot of variables involved in determining how much a premium will be for Medicare supplement. But I can tell you that if you purchase a Medicare supplement when you first become eligible for Medicare, that is going to be your most cost-effective time frame to buy a Medicare supplement. And we'll talk about that a little bit more as we go. So again, Medicare supplements work only with original Medicare A and B. Again, you have to be enrolled in both A and B of Medicare in order to be eligible to enroll in a Medicare supplement. There may be situations where you may not need a supplement. For example, if you are already enrolled in a Medicare Advantage plan, you cannot enroll in a supplement. If you are enrolled in any other kind of Medicare plan, such as a Medicare not an Advantage plan, a Medicare Savings Plan, or some other Medicare structured coverage, you cannot enroll in a supplement. You can only have one type of Medicare plan at a time. And then there may be some situations where you have to enroll in Medicare, and would absolutely not want to enroll or need to enroll in any other kind of coverage. For example, if you are retired military and you are eligible for TRICARE for life, you would not need any other kind of coverage other than Medicare and TRICARE for life. And to purchase anything in addition to that would be not cost effective for you and totally unnecessary. Also, if you are like a para retiree or a federal civil service retiree, or even a private employer retiree that has the option of really good retiree benefits through that employer, you would not necessarily need or want to get a supplement in addition to that coverage. We will talk about more about those options in week 4, our last presentation of this series. But for now, we're going to focus on people who don't have those retiree benefits as an option. With Medicare supplements or Medigaps, because Medicare A and B are your primary insurance in this scenario, and the Medicare supplement is actually your secondary insurance, because Medicare is available with any provider for any medically necessary service anywhere in this country, the United States of America and or our territories, a Medicare supplement goes where Medicare goes. So as long as Medicare opts to pay for a service anywhere in this country for any medically necessary need, as long as Medicare pays their part, the supplement will pay typically the balance. So it does make getting Medicare, original Medicare with a Medicare supplement, one of the most affordable options for coverage that you can use. So if you are someone who intends to do a lot of traveling when you get Medicare or once you retire, if you have family spread across the country and you intend to go visit a lot, original Medicare with a Medicare supplement might be a better choice for you than other options, simply because it is more portable. You don't have to worry about being in a network. You don't have to worry about being out of a network. Medicare is good with any medical provider that will accept it anywhere in this country. And again, as long as Medicare pays their part, a supplement is designed to pay the balance. Any questions about any of this so far? I do see a couple of questions in the chat box. Let me take a quick look. So I do have a question. I am a current DoD government employee with federal health insurance. I have enrolled in Part A. Do I also need to enroll in Part B? Again, if you are actively employed and have employer group health coverage through that active employment, you can delay enrollment into Medicare Part B until you quit working. And then you'd have an extended amount of time to enroll in Medicare Part B, 8 months from the time you're no longer actively employed, to enroll in Medicare Part B without penalty. So as long as you're actively working, no, you do not need to enroll in Part B. If you did enroll in Part B and you're still actively working, your Medicare A and B would be secondary to your employer group coverage because you work for a large employer. So hopefully that answers that question. Next question is, do Medicare supplement costs increase with age? For example, does a 77-year-old pay more than a 67-year-old? And the answer to that is yes. And we'll talk about that a little bit more as we go, but absolutely. Insurance is insurance, and I've never come across any insurance of any kind that doesn't increase in premiums, at least on an occasional basis. But like most health insurance, premiums will go up at least once a year, regardless of any other situation. So just because they can, basically, just because inflation has increased or whatever excuse they can come up with, insurance companies will tend to raise premiums at least once a year. But the older you are when you purchase a supplement, the more expensive it will be when you start. So yeah, the older you are, the more expensive it can be until you hit about age 80. At age 80, the premiums kind of flatten out, and pretty much Medicare has kind of encouraged them not to increase premiums beyond age 80. But again, at age 80, you're probably going to start out at the highest premium they offer. And then my last question is, please define original Medicare. So original Medicare is your Medicare A, your Medicare B. When you are enrolled in Medicare A and Medicare B, you have original Medicare. And if you use original Medicare and you purchase a supplement to go with it, you have original Medicare as your primary insurance, you have your supplement as your secondary insurance. You have to have original A and B of Medicare, original Medicare Parts A and B, to be eligible to enroll in a Medicare supplement or a Medicare Advantage plan. But just A and B. So if all you ever enrolled in was Medicare Part A and Medicare Part B, you have original Medicare. And then the next question is, once you choose a Medicare supplement, are you stuck with that policy forever or can you change it? So I am going to delay answering that question because we will be addressing that in the next couple of slides. So hopefully I will answer that question in the next couple of minutes. If I do not, please let me know. All right. So who can buy a Medicare supplement or Medigap policy? Again, as I've said multiple times, you must have Medicare A and B, both parts, to be eligible to enroll in a Medicare supplement or Medigap. So anyone who has Medicare A and B are potentially eligible to enroll in a Medicare supplement. Then there are guarantee issue periods, which is the most effective time or effective time frame to be able to enroll in a Medicare supplement. Or you can enroll in a Medicare supplement as long as you have Medicare A and B and you can pass medical underwriting. And I'm going to go into detail about what that means. In Colorado specifically, Colorado law does require that Medicare supplement insurance companies that are licensed to sell insurance in the state, they are required to provide supplement insurance coverage to people who have become eligible for Medicare under age 65 with guarantee issue. What that means is, and this is a big, important piece of information to understand. Guarantee issue means that an insurance company cannot look at someone's health history and turn them down based on that health history. If you're under 65 and becoming eligible for Medicare, Medicare does provide a guarantee issue period that gives you an opportunity to purchase a Medicare supplement when they cannot turn you down for any reason. If you're turning 65 and just becoming eligible for Medicare, Medicare also gives you a guarantee issue period. That means you can purchase a supplement without question, regardless of previous health history. If you delay enrollment into Medicare because you continue to work and have employer group coverage, or you're covered under a spouse's active employer group coverage, when you enroll in Medicare at any age, based on your Medicare effective date for both A and B, is when you would be eligible to purchase a Medicare supplement with guarantee issue. And we're going to talk about some of this in more detail. But guarantee issue is an important thing to understand because regardless of any other law, federal or otherwise, for example, the Affordable Care Act, the Affordable Care Act rules that say insurance companies must insure people regardless of pre-existing health issues do not apply to Medicare. So what that means is if you are not in a guarantee issue period to purchase a Medicare supplement of some sort, and you try and purchase a supplement, you would be subject to underwriting, meaning the insurance company would be able to look at your health history, and they'd only be able to look, they can't require a physical. They'd be able to look at your health history, and if they did not like what they saw, they would not have to sell you insurance. So again, the Affordable Care Act rules, all of that kind of stuff do not apply to Medicare. That's why understanding guarantee issue for Medicare supplements is that much more important. If you are under age 65, becoming eligible for Medicare, and you are looking to purchase a Medicare supplement during a guarantee issue period when they cannot turn you down, you need to be aware that even though they can't turn you down, they are going to be able to charge you a higher premium because they can assume that because you're on disability, you are statistically more likely to incur costs. You're going to receive medical services and cost them money. However, if for some reason you can't afford or choose not to get a Medicare supplement when you become eligible at age 65, you would get another opportunity to enroll in Medicare when you turn 65 with guarantee issue. So if you missed your first opportunity when you're under age 65, you do get another opportunity when you turn 65 to have that ability to get into a supplement without underwriting, which of course is going to be the best time to purchase a Medicare supplement for most people. During a Medicare guarantee issue period, you cannot be underwritten. They can ask you medical questions, or they can require that you answer medical questions on the application, but they cannot use that information for any reason to deny selling you a policy. So basically, during a guarantee issue period, you're guaranteed to be able to purchase whatever level of coverage you want to purchase from any company you choose without question. Nobody can turn you down. So it's a very, very important time frame for people who have any sort of pre-existing health issue. Guarantee issue is sometimes also referred to as open enrollment for Medicare supplements or Medigaps. The guarantee issue period lasts for 6 months, but once that 6-month clock starts ticking, it cannot be stopped. And that 6-month clock starts ticking as soon as you have both Medicare A and Medicare B in effect. So if you are someone who's enrolled in Medicare Part A but have delayed enrollment into Part B, your 6-month guarantee issue window or clock does not start ticking until you actually enroll in Part B. So you have to have both A and B in effect before that 6-month clock starts ticking. And that's regardless of why Part B is starting or when it starts. But as soon as you have both A and B in effect, that 6-month clock starts ticking. Once it starts, it cannot be stopped. Once it expires, it's very rare that you get another opportunity to get another guarantee issue period. There are some exceptions to that rule, of course, there always are. But for most people, once that guarantee issue period expires, you would have to fall under a very specific situation to get a special enrollment period to get another guarantee issue period into a supplement. Examples of ways you would be able to get a special enrollment period, which would give you another opportunity to have guarantee issue into a supplement. Any sort of involuntary loss of coverage, and this is a biggie. For example, if you are enrolled in A and B and you are using employer retirement coverage that coordinates with Medicare A and B. So you have A and B, and then you have a retirement and health benefit that's designed to work with Medicare A and B. And somewhere down the line, your previous employer decides to stop all retiree coverage. And they drop all health retirees from their health benefits. That is considered involuntary loss of coverage. It wasn't your fault. So anytime you have coverage that's considered creditable, and that coverage goes away through no fault of your own, it is considered an involuntary loss of coverage, and it would provide you with another opportunity to have guarantee issue into a supplement. If you are enrolled in A and B and you are actively employed and that employment ends, that's considered involuntary loss of coverage. It wasn't your fault that the health insurance ended when the employment ended. If you are on COBRA and you are losing COBRA because COBRA times out, it's a limited time of type of coverage, that would provide guarantee issue into a supplement. The most common way to get guarantee issue into a supplement for most people, though, is by taking advantage of what's called a Medicare Advantage test drive. We are going to talk about that test drive in much more detail when we get to the next topic, which are Medicare Advantage plans, but it is the most common way to get a guarantee issue into a supplement if you miss your initial guarantee issue. So again, Medicare supplements are designed solely and specifically to pay the balance that Medicare Part A and Medicare Part B left over after they paid their part first. So what that means is, as long as Medicare paid their part for any service that you ever need, and there's a balance left over, the supplement is designed to pay that balance. However, if there is a service Medicare does not pay for, the supplement pays nothing as well. If it's a service that Medicare does not cover, the supplement does not cover it either. If it's a service that Medicare covers but denied paying for some reason, the supplement is not going to pick it up. It's only designed to pick it up if Medicare paid first and left a balance. Other things that a supplement will not pay for are going to be anything that Medicare will not pay for, such as long-term care, dental and vision, hearing aids, private duty nurses or room sitters, and then of course the outpatient prescription drugs, which fall under Medicare Part D. So again, as long as Medicare pays for something first, and if they leave a balance, the supplement is there to pay that balance. So potentially between Medicare and a Medicare supplement, you could have almost 100% medical coverage. But if Medicare does not pay for something, or if it's not a benefit of Medicare, or Medicare denies coverage, the supplement also denies or does not pay. So it's not there to pick up if Medicare doesn't cover something. It's only there to pick up what Medicare left over. Any questions about any of that? That was a lot to go over. Looks like I do have a couple of questions in the chat box. Okay, so let me address that question that I had delayed answering. The question is, once you choose a Medicare supplement, are you stuck with that policy forever, or can you change it? So again, the key for Medicare supplements and whether or not you can change policies is going to be underwriting. Medicare provides you that 6 months of guarantee issue for you to have an opportunity to purchase, again, any level of coverage you choose from any company you desire, no questions asked. But once that 6 month window expires, anytime you try to change from one company to another, or even from one level of coverage to another within the same company, you are likely going to be subject to underwriting. And again, if the company does not like your health history, they do not have to make you or let you make that change or sell you a new policy. So it makes that guarantee issue period all the more important to understand. Nothing says you are stuck in a policy forever. Medicare supplements do not have annual enrollment periods. They do not have annual enrollment periods. There's not a one time a year opportunity for you to make a plan change like with other options. Medicare supplements provide a 6 month window of guarantee issue. And then if you can pass underwriting, meaning you're healthy enough that an insurance company wants to insure you, you can change insurance companies as often as you like. There's no limit, there's no time frame, there's no window of opportunity. Anytime for any reason, you can change your policy if you choose to do so. And you can pass underwriting for that company. That does make it kind of a catch-22 for some people, and it makes it that much more important to be comfortable with the company you choose to enroll in if this is the kind of insurance you choose to use. If you have pre-existing health issues, or if you develop health issues that would make an insurance company not want to sell you insurance, you're going to want to be pretty comfortable with the company that you've chosen, because that may be the company that you're going to have to use to insure you for the long haul, because it's not likely that another company would be willing to sell you a new policy. Again, if you're healthy and pass underwriting, you can switch companies every month if you wanted to, no questions asked. So it's not necessarily that you're stuck with a policy forever, but your health situation will be a huge determining factor as to whether or not you'd be able to change to a different policy down the road. Then the next question is, can you discuss coinsurance and how that works? For example, I am still actively employed and I have about a $600 a month deductible deducted from my pay for medical and prescriptions only. A common procedure, and the insurance company declined coverage, but Part B does cover, so that justified the cost of Part B, which I now enrolled in. So when I get this procedure later this year, before I can cancel the employer insurance at the next enrollment period, can you please explain coinsurance in this type of situation? Okay. So I'm going to assume you work for a large employer of 20 plus employees. Because you are still considered actively employed and you have employer group health coverage, that employer group health coverage is your primary insurance. If the employer group health coverage denies paying for a service that Medicare would pay for, once the primary insurance is billed and denies, you have a denial in writing, then the provider can submit that claim to Medicare as your secondary insurance, and Medicare will process either whatever balance is left over or process the whole claim, because your primary insurance denied the whole claim, and they will process it based under their payment schedule. For most services under Part B, Medicare only pays at an 80-20 split after a $203 deductible this year. So if your primary insurance denies, it's billed to Medicare. Medicare is going to process the claim. If that's the first claim they've received for this year, they're going to apply the $203 deductible first. Then they're probably going to pay for that service at an 80-20 split based on whatever their payment rate is for that service. And if that's your only coverages, you would be liable for the $203 deductible and whatever the 20% coinsurance balance is. So coinsurance refers to percentage left over, where a copay typically refers to a flat dollar amount that's applied to a specific service. For example, an office visit has a $40 copay. You pay that up front. With original Medicare A and B, you have typically co-insurances where Medicare paid a percentage and the balance left over is your co-insurance. With those being your only coverages, you would have some out-of-pocket cost after Medicare paid their part first. I hope that answered that question or explained that. Please let me know if it didn't. Okay. Thank you. Okay, good. All right, any other questions before we move on? So again, I did send an email to everyone earlier this afternoon that included both the slides for today's presentation as well as the handouts that I'm going to get ready to reference. So again, we've talked about what supplements don't cover. In the email that I sent earlier today, there were 2 handouts specific to Medicare supplements. The first handout is this chart. This chart outlines the different levels of coverage that you have to choose from as a Medicare supplement. So earlier I mentioned that Medicare supplements are standardized. What that means is Medicare has determined that there are going to be 10, 11 levels of coverage to choose from. These levels of coverage are set in stone. What that means is any company that sells Medicare supplements anywhere in the country sells the plans and the plan levels outlined on this chart, period. The plan levels are labeled A through N, like the alphabet. Keep in mind, Medicare supplements are designated as plans. Medicare parts are designated as parts. So it's easy to get those confused. So you have Medicare Part A and B. For supplements, you have plans A through N. I'm going to quickly go over the benefits that are available under these levels of coverage so that you understand what you're purchasing based on the level of coverage that you choose to purchase. So again, because Medicare supplements are designed to pick up the balance that Medicare left over, this chart is going to detail what part or what balance Medicare is paying, or what balance the supplement is paying, I'm sorry. So again, A through N are the plan labels. They used to be A through J, like the alphabet, but several years ago, Medicare chose to discontinue plans H, I, and J. They replaced them with plans K, L, M, and N. But instead of just redesignating H, I, J, and K, they just took them out and kept on going up the alphabet. So it's not in an orderly fashion, but you get the idea. So looking at this chart, if you look at supplement plan A, under supplement plan A, and we're going to look at what benefits are listed under each plan designation. If you look at supplement plan A, what you see is the box that says basic benefits. Basic benefits includes 100% of the Part B coinsurance. Basically what that means is Medicare supplement plan A only picks up the 20% Medicare leftover for Part B services after Medicare paid their part first. That's what it means by basic benefits, 100% of the Part B coinsurance. It's going to pay that 20% leftover for Part B services. And that's it under Plan A. Under Plan B, it's going to pay 100% of the 20% coinsurance for Part B services. But it's also going to pay your inpatient Part A hospital deductible every time you're admitted. Again, that Part A hospital deductible per admission is $1,484 this year. Plan B and higher will pay that deductible every time you're admitted to the hospital. I'm going to skip Plan C and go to Plan D, and then I'll tell you why in a few minutes. Under Plan D, Medicare supplement, it covers 100% of the Part B coinsurance. It covers the Part A inpatient hospital deductible every time you're admitted. It also covers skilled nursing coinsurance. So if you recall from last week, if you are inpatient in a hospital for 3 days or more and then admitted to a skilled nursing facility for rehab or recovery, Medicare Part A covers 100% for the first 20 days of that skilled facility stay. And then starting at day 21, Medicare will continue to pay everything except for a daily coinsurance. Again, this year, that daily coinsurance amount is $185.50 per day, starting day 21. If you have a Plan D or higher level of supplement, that plan will pay that $185.50 per day for you. So you would have between Medicare and the supplement up to 100 consecutive days paid at 100% between Medicare and your supplement. At the very bottom of Plan D's column, you'll also see foreign travel emergency. Because Medicare coverage, Medicare benefits stop at the border of the United States of America and/or our territories, you can't take it with you if you go overseas or leave the country. Medicare supplements, some of them do have this foreign travel emergency provision. It is not actual insurance coverage. What it is a reimbursement. So if you happen to be in a foreign country and you have a medical emergency in that foreign country, you would pay for that emergency while you're there. When you got back home, you could submit that cost for that medical emergency to your supplement for reimbursement. So it's not going to provide coverage while you're in a foreign country, but it could potentially reimburse the cost of a medical emergency while you were in a foreign country once you get home. The foreign travel emergency provision can be a little daunting because they are going to require that you bill Medicare first and Medicare deny it, and you submit that denial to them. Once Medicare denies your charge or your claim for coverage outside of the country, you submit that denial and your medical receipts for that service to your supplement. They will reimburse you up to 80% of the cost of that medical emergency after a $250 deductible is applied. It can be time consuming, but it is some reimbursement in that scenario. Moving on to Plan G. And you'll notice as we go up the line on this chart, you are getting more benefits covered under these levels of coverage. Plan G is currently considered the Cadillac of Medicare supplement coverage. Plan G, of course, covers 100% of the Part B 20% coinsurance, covers 100% of the skilled nursing coinsurance starting at day 21, covers the Part A hospital deductible every time you're admitted, has the foreign travel emergency provision, and it also has an extra benefit, Part B excess. Part B excess refers basically to how your Medicare doctors get paid. When you have Medicare A and B, original Medicare as your primary insurance, again, you can go to any medical doctor or provider that accepts original Medicare anywhere in this country for any medically necessary reason. But there are basically two different ways Medicare doctors can accept you as a patient. And it all refers to how they get paid. The most common way providers get paid is by accepting Medicare Assignment. What that means is when you have a medical provider who accepts Medicare and Medicare Assignment, basically this is how it's going to work. Say, for example, you go to your primary doctor for an office visit. That primary doctor accepts Medicare Assignment. You go in for your office visit. You show them your Medicare card, you leave. Typically, when a provider accepts Medicare Assignment, they are not going to ask you to pay anything up front. That doctor is going to bill Medicare directly for that service. So the doctor's walk-in rate or cash rate or retail rate may be $300 for an office visit. So he's going to bill Medicare $300 for that office visit. Medicare is going to turn around and they're going to assign $100 to that office visit. That's what they say that visit is worth. Medicare is going to pay 80% of what they assign. So even though the doctor billed Medicare $300, honestly, that doctor knew Medicare was only going to allow $100 and pay him 80% of that $100. The supplement under basic benefits will pay the other 20% of that $100. So the doctor gets paid a total of $100 between Medicare and your Medicare supplement. That doctor accepts Medicare Assignment, meaning they accept whatever amount Medicare assigns for their services as payment in full. When a doctor does not accept Medicare Assignment, it basically works the same way. You go in for your office visit. That doctor is going to bill Medicare their $300 rate. Medicare is going to turn around and assign $100 to that service and pay 80%. Supplement's going to pay the other 20%. The difference is when a doctor does not accept assignment, that doctor is actually allowed to charge you, the patient, 15% above and beyond what Medicare assigns for their services. Medicare has a predetermined, preset dollar amount for any and every service you could ever possibly think of receiving. It's already predetermined. Any service they are willing to pay for, they've already got a predetermined dollar amount that they will pay. And doctors know this. And most of the time, doctors can find out what that predetermined amount is. So when you go into a doctor's office that does not take Medicare Assignment, most likely what's going to happen is that doctor is going to ask you to pay $115 upfront. The $100 that they know Medicare is going to assign for their service plus 15%. They're going to ask you to pay that upfront all at once. They're still going to bill Medicare because by federal law, Medicare providers are required to bill Medicare for you. Medicare does not want you submitting claims yourself. Medicare is still going to turn around, assign the $100, pay 80% of it. But when Medicare gets that claim, they're going to see that that doctor does not take assignment, and they're going to assume you've already paid the doctor $115. So when Medicare processes their 80% of $100, they're going to send you a check for $80. They're going to forward the balance to your supplement. The supplement's going to do the same thing, and they're going to send you a check for $20 so that you get reimbursed the Medicare assigned amount. If you have a supplement that includes Part B excess benefit, the supplement would also reimburse you that extra 15% you paid up front. So they would reimburse you $35 instead of just $20. So that extra 15% you paid up front is Part B excess. Now, having explained all that, is that a very common scenario to run across? Not necessarily. There are providers in Colorado Springs area that do not take assignment. I think there's one doctor's office that I can think of off the top of my head. Most providers that take Medicare will take assignment. So you wouldn't have to worry necessarily about that benefit or that extra amount. However, I can say that about this area. I cannot say that about any other area. Again, if you plan on traveling or being out of town for extended amount of time, I have no idea what kind of providers are available in the area you're going to, and that might be more of an issue in those areas. So just something to keep in mind. Not typically a huge, straw that breaks the camel's back kind of benefit that would be the tiebreaker on whether or not you get that level of coverage or not, but it is good to know about it. Once we get past Plan G, when we start going into Plans K, L, M, and N, you'll notice that benefits start being described in percentages. So for Plans K and L, Plans K and L only pay out benefits at a percentage of what other plans cover. So Plan K, for example, only covers Part B basic benefits, that 20% for most services, at 50% instead of 100% like the other plans. It only pays 50% of the skilled nursing facility coinsurance. It only pays 50% of your hospital deductible. Because it pays a significantly lesser amount of benefit than the other plans, it is significantly less costly in premium. And it does have an out-of-pocket maximum, meaning if after they've paid their part and Medicare's paid their part and you pay the balance, if you spend more than $6,220 this year, that plan would have to start actually paying 100% for those services for the rest of the calendar year. And then come January, it'd go back to being 50%. Plan L, very similar, except it pays benefits at 75% instead of 100% for those same services. Again, pays less in benefit, so it has a lower premium. It also has a lower out-of-pocket max because it pays a little bit more than the other plan that pays only 50%, $3,110. Plan M, as in Mary, is kind of a hybrid. It pays 100% for Part B coinsurance. It pays 100% for skilled nursing facility coinsurance, but it only pays 50% for inpatient hospital deductible. Does have the foreign travel emergency clause though, which is nice to have. Plan N, as in Nancy, is actually becoming one of the more popular plans to purchase. Plan N is also a hybrid. It pays 100% for Part B services. The 20% coinsurance for every service except office visits and emergency room visits. For office visits of any kind, you would pay a $20 copay. For any emergency room visit, you'd have a $50 copay. What that means basically is the providers bill Medicare, Medicare pays their 80%. If the balance left over is greater than 20%, your supplement would pay everything except for $20. If it was less than $20, the 20% balance, you'd still have to pay $20 or $50 respectively. But that plan does pay 100% for the skilled coinsurance. Excuse me, and it pays 100% of the Part A hospital deductible. Again, these plans pay lesser in benefits, so that premiums are lower than the initial half of this chart. As far as I'm concerned, quite frankly, as long as a plan covers the three most important benefits, are the three benefits that you're most likely to use in your lifetime, you will have adequate coverage. And those three benefits are obviously going to be the basic benefits, that 20% coinsurance for Part B services, excuse me, skilled nursing facility coinsurance, and the hospital deductible. Everything else is kind of icing on the cake. So honestly, I don't typically encourage people to look at Plan A or Plan B supplement because it's simply not going to be adequate coverage if you have medical services. Now I skipped over Plan C and F. Plan C and F, and they're shaded in gray. For most people who are becoming eligible for Medicare, Plan C and F are not an option. You cannot purchase Plan C and F if you are becoming eligible for Medicare today. However, if you were eligible initially for Medicare prior to 2020, prior to January 1st of 2020, so say you were originally eligible for Medicare 4 years ago, but you continued to work with employer coverage, you delayed enrollment into Medicare. And now you're getting ready to retire, you're going to enroll in Medicare A and B, and that's why you're looking at coverage. Because you were originally eligible for Medicare prior to January 1st of 2020, you actually have the option of purchasing a Plan C or Plan F supplement. But again, anybody eligible for Medicare, initial eligibility for Medicare after January 1st of 2020, Plan C or F are not an option. The differences between Plan C and F and Plan D or G, and they're side by side, so it's easy to tell the difference. Plan C and F, the only difference between C and F and D and G are that C and F include a Part B deductible benefit. The reason Plans C and F are no longer available for most people is because they included a Part B deductible benefit. The government has decided in the last few years that if you have insurance coverage that has first dollar benefits, meaning if your supplement insurance created a situation where you had to pay nothing out of pocket besides your premiums, it was too good. If you had purchased a Plan F, literally between Medicare A and B and a Plan F supplement, the only out-of-pocket you have is your premiums. Plan F pays everything else after Medicare, period. That was too good. It is too good a coverage for us to be allowed to have, and that's why it has gone away. And it is no longer available for people becoming eligible for Medicare. That Part B deductible benefit is what caused those plans to no longer be available. But again, if you were eligible for Medicare prior to 2020, you would still have guarantee issue into those plans. Plan F was always considered the Cadillac of supplements. Plan G now is considered the Cadillac of supplements. But again, the only difference between those plans and plans that are currently available is that Part B deductible benefit. Again, the Part B deductible, $203, a drop in the bucket. Any questions about these levels of coverage? I do see a couple of questions. Does the assignment process work the same for all types of doctors and other providers, such as occupational or physical therapists, as well as hospitalization? So typically for Part Part B excess is going only to apply to Part B services. That's why it's called Part B excess. So any Part B services, I'm not going to say any, 99% of Part B services, yes, that assignment process works the same way. If they take assignment, they have to accept whatever Medicare assigns and cannot charge you above and beyond. If they don't take assignment, they're allowed to charge you that limited 15% above and beyond. There are exceptions to that rule, unfortunately. For the most common exception is going to be for durable medical suppliers and some types of supplies, where there is no limit to what they can charge you above and beyond what Medicare assigns. But that would be for some very specialized supplies. It would not apply to hospitalizations because, again, an inpatient hospitalization, you only have to worry about a flat deductible. Next question. And next question about recorded sessions, yes, and I will address that at the end. Okay, next question is, I keep seeing ads on TV about Medicare Advantage plans that pay every month plus $0 for Medicare Part B amounts. It seems like deceptive advertising or a scam. Should such offers get avoided? That's a really, really good question. I see those commercials too, and I get very, very frustrated by them because those commercials do make Medicare Advantage plans sound like they cover everything under the sun with no cost to you, including benefits that Medicare doesn't cover. And some are even now starting to advertise that they will pay your Medicare premium for Part B. What I can tell you is that if it sounds too good to be true, obviously life has taught us that it usually is. Those commercials are not specifically being intentionally deceptive, but they're not really telling you the whole truth. It's a fine line, a really gray area when it comes to advertising. But unfortunately, everything they're doing is legit. What I would suggest, if anybody is interested in pursuing the information you may see in a commercial like that, is to be very, very, very careful if you call those phone numbers. Those people that answer the phone at those phone numbers are going to tell you all the nice things about those kinds of plans. They're going to be sometimes aggressive or very, very forceful in their sales pitch, but they may not necessarily explain everything that you need to know about those kinds of plans. And we are, again, going to be talking about supplements here next. I know we're running over time and I'm going to try and hurry up, but I think this is a very important subject to understand. Again, if you are thinking in your head that something doesn't sound right, flags are going off, bells and whistles are going off in your head, you should probably listen to those bells and whistles. We're going to talk about our Medicare Advantage plans next, and hopefully that'll help clarify what you should and should not be looking at or listening to. Next question real quick, does foreign travel emergency coverage vary in any way across the various plans? No. Foreign travel emergency provision, and it's more of a provision than a benefit because it only reimburses after the fact. It doesn't matter what foreign country you're in, as long as you paid and it was a medical emergency. It has to be classified as an emergency, and it would not be covered by Medicare because, again, you're going to have to bill it to Medicare to get a denial before the supplement will reimburse you. But it's the same flat benefit across all plans that offer that provision. Whether or not they have a differing definition of emergency, honestly, I couldn't say. But emergency, the definition of an emergency is going to be pretty standardized, I think. I've never come across anybody who's run into that issue, quite frankly. I wouldn't think that they would have a differing definition of emergency to avoid paying that, but I honestly can't say for sure. So if you want to pursue that and follow up with me, we can talk about it some more after the presentation. And then last question, I think, before we move on, does Plan G pay for a silver sneaker-like program so I can get a free gym membership? Okay, so things like silver sneakers used to be one of the biggest selling points of Advantage plans a few years ago. It is now far down on the list of other selling points that these Advantage plans are touting these days. Typically, free gym memberships like silver sneakers were available only through Advantage plans as kind of an incentive to get you to enroll in an Advantage plan versus a supplement. However, what I can tell you is that typically some of the larger insurance companies, AARP United, Humana, Anthem Blue Cross, those are the big three. Because those three companies specifically have their fingers in all the different types of Medicare insurance pots. So they sell Medicare Supplements, they sell Medicare Advantage Plans, they sell Medicare Part D plans. Because they have their fingers in all the pots, those companies are more likely to continue to offer the free gym membership programs through their supplements, as long as they offer them through their Advantage plans as well. So not every company will offer a free gym membership, and it does not matter what plan level you are going with. It's going to be more based on the company that you choose. As long as the company offers that, then it would be a benefit. But again, not a lot of companies will offer a free gym membership with their supplements. It's usually going to be the big three that have programs in all the different kind of Medicare options that will offer that in addition for their supplements. I hope that makes sense. Okay, moving on. The other handout I provided regarding Medicare supplement policies, this is put out by our Division of Insurance up in Denver. We are very, very fortunate in Colorado that our Division of Insurance goes to the time and trouble to put this document together. It only comes out once a year. Last year, it came out a little bit late in September. I don't anticipate another one will come out until at least September of this year, simply because last year it was because of the pandemic. This year it's because the director of that agency up in Denver retired or resigned, and they are without director right now. So whether or not this particular publication gets published for 2021, I cannot say for sure. But until September of 2021, this document is still relative. And even after September of 2021, if we don't get an updated version for 2021-22, this document is still relevant. And I will tell you why. This document is put together by the Division of Insurance to provide premium information for the insurance companies that are licensed to sell supplements in Colorado. The first several pages of this document is basically going to give you information, brief paragraphs about everything we've already talked about. Guarantee issue, underwriting, that kind of stuff. You get halfway through this document and you start getting to these charts. These charts are what most people are interested in. If you look at the very top in the middle of the page, and I know my PDF converter didn't convert the language clearly, but that should say age 65. The second half of this handout is going to have a different age group at the top of each page for the next 3 or 4 pages. So this page says age 65. You flip to the next page, it's going to say age 70. The next page is going to say age 75. So it's broken up into 5-year age groups. It's going to list along the left-hand column every company licensed to sell a Medicare supplement in the state of Colorado in alphabetical order, front to back of each page. So there are like approximately 45 companies licensed to sell Medicare supplements alone in the state of Colorado right now. Listed in alphabetical order, it's going to give you their name, their phone number. it's going to have A through N across the top, just like this previous chart we were just looking at, A through N. What this handout is going to give you is an approximate monthly premium for any level of coverage that any of these companies may sell. So if you intersect company X, let's go with Blue Cross Blue Shield, with Plan G, where these two columns meet, if there is a number in those boxes, that number represents an approximate monthly premium for that plan with that company for that year. I am going to stress the word approximate. This handout is not designed to give you price quotes at all. It is designed to give you an idea of what the approximate premium range will be if you were to call them directly. It's designed to show you the difference in premium ranges between company to company. So it's going to show you which companies charge more and which companies charge less to start with. It's going to give you a ballpark idea of what premium you might pay for a plan with that company, but is not designed to give you a price quote. So if you see a premium in a box on this handout and then you call up the company and there's a $20 difference, don't yell at me, please, because this is not designed to give you that price quote. It's designed to give you an idea of where that price range is. But the most important thing it's going to do is tell you who's out there and give you a ballpark idea of what it's going to cost if you went with them. The thing I like most about it is it gives you an idea of what companies charge less and what companies charge more. Because the bottom line is, you'll notice that most of the columns, most of the boxes in column G are full. That means every company listed on this page sells Plan G. Any company that sells Plan G is selling the exact same Plan G as the other guy. A Plan G is a Plan G is a Plan G, no matter who you buy it from. These companies cannot alter in any way those levels of coverage that we just looked at. A Plan G is a Plan G is a Plan G. They cannot add to these plans. They cannot subtract from these plans. These plans are set in stone. They're standardized. So every company is selling you the exact same coverage under Plan G. But if you look at this page, you'll notice that the price for Plan G between these varying companies can be quite significantly different. For example, if we look at Humana down here, they rate a Plan G at $198 a month. Whereas if we go up to AARP, you're looking at $120 to $135 a month. That's a huge price difference. And it's good to know what kind of price differences there are between these companies that are selling you the exact same product. You'll also notice that there could be a price difference between men and women. Typically, you're going to see that men pay more than women. And that's because statistically, women tend to take better care of themselves and live longer. So you'll notice that women tend to have lower premiums. Some companies will charge the same price whether you're man or woman. They don't care. So again, this is designed to help you narrow down the number of companies you would be interested in even contacting to get a direct quote or a specific quote from. It's going to give you an idea of what kind of cost you're looking at. And again, keep in mind, insurance is insurance and insurance premiums go up. Even if it's a little bit every year, you can be guaranteed that you're going to have at least a once a year premium increase to this kind of insurance coverage. So you need to plan for that. If for some reason I do get an updated handout from the Division of Insurance before open enrollment, I'm happy to provide that information to anybody who requests it. So if you would be interested in knowing whether or not an updated handout was processed through the Division of Insurance, you're welcome to contact me sometime towards the end of September, and I'll be able to let you know if we're going to have one before open enrollment. And I know that took an extra lot amount of time, and we are running over, and we haven't even got to Medicare Advantage Plans yet, so I appreciate your patience. but I think this is, again, a very important topic and very important information to understand. Any questions before we move on to Advantage plans? You guys have had some really good questions tonight, and hopefully you can all hang in there while we go through Advantage plans. Okay, here's a question. If I choose plan N from company 1, and then some years later want to change to a different plan from the same company, do I have to go through underwriting? The answer is likely yes. So whether you're changing from company to company, or if you're changing level of coverage within the same company, you could be subject to underwriting. And the longer you wait between doing that change, the more likely you will be subject to underwriting. You're usually more likely to be able to downgrade your coverage if you're trying to change levels of coverage within the same company versus upgrading that coverage. Going from lesser coverage to better coverage is going to be harder than going from better coverage to lesser coverage. So hopefully that answers your question. It makes it all the more important for you to be very, very comfortable with whatever level of coverage you choose to enroll in initially, because that may be the level of coverage you have for the long haul. And you want to be very, very comfortable with that. Again, this is not the kind of insurance you have an annual opportunity to change. For many people, it might be a one and done. This is your one chance during guarantee issue to get the best level of coverage you can afford, and hope that it's going to get you through basically the rest of your life. Because if you ever drop this kind of coverage altogether, you may not ever be able to get it back unless you can somehow fall under another special enrollment period that would give you guarantee issue. Okay. So let's talk about Medicare Advantage plans. And some of the stuff we've talked about before will start making more sense when we start talking about Advantage plans. Again, Medicare Advantage plans are an entirely different kind of animal, entirely different kind of insurance than Medicare Supplements. With Medicare Advantage plans, basically you are enrolling in a plan with a private insurance company, but that company has contracted directly with Medicare to act on Medicare's behalf, and basically to act as Medicare. When you enroll a Medicare Advantage plan, you still have original A and B of Medicare. You still have to pay the Medicare Part B premium, period, because you have to have A and B to be eligible to enroll in an Advantage plan. But basically, once you're enrolled in that Advantage plan becomes your Medicare, becomes your primary coverage in place of Medicare. And that's why sometimes it's referred to as a replacement plan. Regardless, you still have all the same rights and protections as original Medicare. You still get access to all the same Medicare covered services. But these plans are called Advantage plans for a reason. And that's because typically they are going to offer extra benefits above and beyond what original Medicare covers, such as hearing services or vision services or dental care, gym memberships, all those extra benefits that are not benefits of original Medicare. The other advantage to most Advantage plans is that they typically will include the prescription drug benefit, Part D, rolled up into the package. So it's all combined, A and B and D, under a private insurance company. With Medicare Supplements, original Medicare and Medicare Supplement, that does not come with drug coverage. You have to purchase a Part D separately in addition to Medicare and the supplement. With Advantage plans, that Part D benefit is typically going to be part of the coverage, part of the package. There are a little bit more requirement to enroll in the Advantage plan as well. You must live in the plan's service area. Basically, what that means is you must purchase an Advantage plan that is available for purchase in the county you reside in. Because these plans are going to be limited by county, or service area is going to be your county of residence, they're typically not necessarily going to be usable outside of that service area or that county of residence. So you must purchase a plan that's available for purchase in the county you live in. Again, must be enrolled in A and B of Medicare. And you can only enroll during an eligibility period. However, there are a lot of eligibility periods to enroll in an Advantage plan sometimes. But purchasing a plan in the county you reside in is going to be the biggie. With Advantage plan, there are multiple enrollment periods you have the ability to use. The initial enrollment period, just like with any other part of Medicare's initial enrollment period, is going to be surrounding that 7-month window surrounding your initial eligibility of turning 65. So typically the 3 months prior to the month of your 65th birthday, the month of 3 months after the month of your 65th birthday, that is your initial enrollment period. That would be your opportunity, your initial opportunity to enroll in an Advantage plan. Once you're enrolled in an Advantage plan, or if you do not enroll in an Advantage plan during that 7-month window, you would have the opportunity to enroll in an Advantage plan at other times. Most common additional enrollment period would be the annual election period, typically what we refer to as just annual open enrollment. Annual open enrollment is when people with Advantage plans or Medicare Part D standalone drug plans have an annual opportunity to look at what other options are available for the next year and make a plan change without restriction into those other Part D or Advantage plan options. If you are already enrolled in a Medicare Advantage plan, or you enroll in an Advantage plan during the annual open enrollment period, which would go into effect January 1st of the next year, as long as you're enrolled in an Advantage plan as of January 1st, you would have an additional enrollment period called the annual Medicare Advantage plan open enrollment period to make yet another change of your Advantage plan. This is an additional 3-month window. So the annual enrollment period is the October 15th through December 7th enrollment period. And any change or enrollment you do during that time frame goes into effect in January. If you have the Advantage plan as of January 1, the second annual Medicare Advantage open enrollment period would give you another 3 months of opportunity to change to a different Advantage plan or drop Advantage plan altogether. And then there are always special enrollment periods surrounding typically other types of involuntary loss of coverage. Again, annual open enrollment, typically I just refer to it as open enrollment, October 15th through December 7th every year. This applies to people who are interested in getting into, getting out of, or switching from one to another Advantage plan or Part D plan without restriction, and any change they make during that time frame would go into effect January 1st. Again, the Medicare Advantage open enrollment period starts January 1st through March 31st. Applies only to people who are enrolled in an Advantage plan as of January 1st and gives you an additional 3-month window of opportunity to either switch to another Advantage plan one time during that window, or if you have an Advantage plan and decide you don't want it to be an Advantage plan, it would give you an opportunity to get out of the Advantage plan, back to original Medicare, and enroll in a Part D plan so that you had drug coverage. It would not provide you a guarantee into Medicare Supplement. Special enrollment periods are going to, again, surround situations that are typically going to be involuntary loss of other coverage. So that would include if you enroll in an Advantage plan in El Paso County and then you move to Denver, because you had to enroll in the plan in the county you reside in, when you move out of the county, you cannot take that plan with you. That is not your fault. That is considered involuntary loss of coverage. That would actually provide you with a short window of guarantee issue into a supplement, or a short window to give you the chance to enroll in another Advantage plan when you get to where you're going. If the plan you enroll in, the Advantage plan that you enroll in El Paso County, decides in 2022 that they are not going to sell plans in El Paso County anymore, they're pulling out, again, you're going to lose coverage. It's not your fault. That again would provide you with a short window of opportunity to have guarantee issue into a Medicare supplement, or give you the chance to enroll in another Advantage plan available in that area. Any other loss of other credible coverage, such as retiree benefits and so forth, would also provide that opportunity. The test drive, I mentioned this earlier, the most common way that someone can have an opportunity or an additional opportunity or an extended opportunity of guarantee issue into a supplement is through the test drive for Advantage plans. The test drive for Advantage plans is basically an opportunity for beneficiaries to test out or to test drive the Advantage plan to see if it's the kind of coverage that's going to work for you for the long haul, see if you like it or not. And if you don't, you would still have the ability to get a supplement with guarantee issue. The way that works is basically it's a one-time option that you can use one of two ways, and it's a limited time option. If when you first become enrolled in Medicare A and B, and you enroll in an Advantage plan immediately, you would have up to 12 months to test drive the Advantage plan to see if you like it. If for any reason within that 12-month window, you decided Advantage plans are not for you, you would be able to get out at any time and still have guarantee issue into a Medicare supplement. So in a situation where you enroll in the Advantage plan when you first get Medicare, it can basically extend your guarantee issue into a supplement from 6 months to almost 12 months. So if you use that test drive all the way up until the last minute, and you decide in month 11 that no, you really want a supplement, you would still have guarantee issue into a supplement, even though your 6-month guarantee issue expired. The other way you could use the test drive is if you enroll in Medicare A and B and you go immediately into a supplement. And you have a supplement for a few years, and then suddenly you decide, you know, all your friends have Advantage plans, they're not paying any premiums, you're paying premiums, you know, you want to see what the hype's all about. You'd be allowed to drop your supplement, enroll in an Advantage plan during the annual enrollment period, and have that up to 12-month opportunity to test drive out the Advantage plan to see if it worked for you. Again, if at any time within that 12-month window, you decided this is not for you, you'd be allowed to drop it and get out and go back to the supplement you left with guarantee. So you'd be able to be guaranteed back into whatever supplement you left. The caveat to that, though, is that you wouldn't necessarily be paying the same price that you were paying when you left that supplement. Prices would probably go up. You'd still be guaranteed to get it back, but you may be paying more for it if that happens. So honestly, it's more cost effective for most people to try the test drive when you first become eligible for Medicare to see if it's going to work for you or not, and still be able to get guarantee issue into a supplement if ultimately you decide the Advantage plan is not for you. Any questions about any of that so far? Let's see. Got a couple of questions in the chat. I see a lot of plans are available in Southern Colorado. Does that area include El Paso County? So any plans that are available in El Paso County. So again, these plans are designated by county because the county is basically the service area. So you have to purchase a plan that's available for purchase in El Paso County. Even if it says Southern Colorado, it's still county by county. So the same plans may be available through the whole south of I-25 corridor, but there's still going to be individuals plan enrollments based on the county that you reside in. So it's not necessarily Southern Colorado, it's El Paso County, it's Pueblo County, etc. Do all Advantage plans provide the same coverage? Similar to all Medicare Supplement plans provide the same coverage. Okay. So again, Medicare Advantage plans absolutely must provide the same benefits and coverage as original Medicare. At minimum, they have to pay and cover any services that original Medicare A and B would cover, period. Are the plans the same? No. They're all going to be very similar, but the difference is going to be in what your out-of-pocket costs are, what the premiums are, what kind of drug coverage the plans have, because that's going to be an important factor for a lot of people. So they're going to be similar in that they have to cover anything that Medicare A and B would cover, absolutely. But your costs out of pocket will definitely be different. So speaking of costs out of pocket, keep in mind, even if you get a 0 premium Advantage plan, you still have to pay your Part B premium. Some Advantage plans may have an additional monthly premium, although there are several Advantage plans in this area, El Paso County, or even Teller County, that may have a 0 premium as long as you're paying your Part B premium. And again, these are very different kinds of coverage, so you will have typically an out-of-pocket cost for most every service you receive while you're enrolled in an Advantage plan, in the form of co-pays, co-insurance, or deductible. So generally, all Medicare covered services, you must get them through the plan. So it's not like you have A and B and then the Advantage plan. The Advantage plan is now your A and B of Medicare. Again, most plans will include Part D drug coverage at no extra cost, but you may be limited to what providers, doctors, hospitals you can use or go to, except in the case of an emergency. Medical emergencies are covered at the same rate anywhere in the country with any medical provider, and the plan will pay it. But as I mentioned, benefits and cost sharing will be different than with original Medicare. And just to make it a little more interesting, there are multiple different kinds of Advantage plans. There are about 8 different kinds of Advantage plans to choose from. And this is where it gets really fun. So most common Advantage plans that we're going to find in this area are going to be HMOs, health maintenance organizations, preferred provider organizations, and occasionally you might find a private fee-for-service Advantage plan. Our area also has a special needs plan. And if you're interested in getting a full list of all the plans available throughout Colorado, you can call 1-800-Medicare and request a Colorado-specific Medicare new handbook, and it lists all of those plans at the back of the book based on county and service area. You can do that by going to Medicare.gov and requesting it, or calling 1-800-Medicare 24 hours a day, 7 days a week, and request a Colorado-specific Medicare new handbook. Additional Advantage plan options, Medicare savings accounts. Unfortunately, we don't have any companies selling those in Colorado at this time. Medicare cost plans, I'm not really going to talk about simply because they are being sunsetted. Basically, they're being phased out by Medicare. Demonstration or pilot programs, again, currently none available in Colorado. But we do have a PACE program for all-inclusive care of the elderly in our area and most of the metro area of Colorado. And we will talk about that in more detail. So we're going to talk just a little bit about each specific type of Advantage plan. HMOs, again, going to be the most common type of Advantage plan available. HMO is an HMO is an HMO. If you've ever been enrolled in an HMO, you know what that means. HMOs are the strictest type of plans out there. You are generally required to stay in network. You're required to have a primary care physician designated to you. You will pay a copay for most every service you receive under that plan. If you need a specialist or to receive any sort of advanced need medical care, you will likely require a referral from your primary doctor or a prior authorization from the insurance company. If you go out of network, the plan does not cover you, Medicare does not cover you. So if you go out of network and you're enrolled in a Medicare Advantage plan, out of network, you're paying completely out of pocket. Except, of course, with the exception of a medical emergency. And Medicare HMOs will include Part D coverage, Part D benefits, the drug coverage. Medicare PPOs or preferred provider organizations, kind of a hybrid. Preferred provider organizations have a network of providers they would prefer you use, but you're not limited to staying within that network. You're allowed to go out of network in a PPO. So you can go to any doctor or provider that will accept a PPO plan. Because you're allowed to go out of network in a PPO, they do not require referrals for you to see specialists or to go out of and see an out of network provider. But you may be still required to get a prior authorization for some services. As long as a provider or a doctor is willing to accept the plan and what the plan pays them, plus your copay, most providers will take it. They're not required to take your PPO. So if you have a particular provider you were interested in seeing and you check with that provider and they say, no, we don't take your PPO, you cannot see that provider and expect it to be covered. PPOs may or may not include drug coverage. Some PPOs are sold specifically without Part D coverage to specific populations such as retired military. If you purchase a PPO that does not include a drug benefit, you are not going to get drug coverage of any kind through Medicare because it's expected that you have another means of drug coverage, such as the VA, for example. You would not be able to enroll in a Part D in addition to a PPO. Fee-for-service plans were initially designed to be the most flexible Advantage plans because they are designed not to have a network at all. You would be able to see any medical provider that's willing to accept the fee-for-service anytime for any reason. As long as they're willing to accept the plan's payment and your co-payment is payment in full, you're good to go. On the downside, there is no network, meaning they are not responsible for having a network or contracted list of providers that you have the option to use. It becomes your responsibility to make sure that you can find a provider willing to take that kind of coverage. Again, because there's no contract, providers can decide on a case-by-case basis if they want to take you in your coverage. So if they decide they will see you as a patient one time, and then you call for a second appointment, they can decide that no, they don't want to see you a second time, and they're allowed to do that. Fee-for-service plans also may or may not include drug coverage, but if a plan does not include drug coverage as part of the benefit package, you would be allowed to buy a Part D plan separately in addition to the fee-for-service. Special needs plans are basically going to be Medicare HMOs for very specific population, specifically for people who are Medicare and full Medicaid, long-term care Medicaid beneficiaries, or people who live in certain institutions such as long-term care facilities, or for people who have qualifying chronic health conditions. Special needs plans are not available in every service area of Colorado. Again, the Medicare New Handbook would be able to give you a list of any special needs plans and where they're located. We do have a special needs plan in El Paso County, but again, it's basically going to be specifically for people who are Medicare, Medicaid, or living in a long-term care facility or have specific long-term chronic health conditions. If you want additional information about these kinds of plans, please just shoot me an email after this presentation and I'll be happy to address that with you directly. Again, I'm not going to talk about cost plans because they are being sunsetted and are phased to go away completely within the next year, year and 6 months, year and 5 months. And none are currently available in El Paso County anyways. PACE, Program for All-Inclusive Care for the Elderly. Basically, the PACE program is going to be a Medicare HMO on steroids, but again, for a very specific population of people who are Medicare and long-term care Medicaid eligible. This is a program that's designed to help people stay in the community in their homes versus having to go into a long-term care facility. So it's basically designed to keep people at home instead of having to go to a facility, because it provides extensive case management and more hands-on management of their benefits and service needs. Again, you want more information about this program, please contact me and we can talk about it in more detail. Your rights and protections in a Medicare Advantage plan. Again, you have all the same rights and protections as original Medicare. Additional rights you have in Advantage plans is you have the right to have access to healthcare providers. So the plan is required to make sure that they can find a provider willing to take their coverage in the county that they are selling that plan in. So even in a fee-for-service plan, providers are required to have at least one provider who has agreed to take that coverage in that county. You have the right to know how your providers are paid. You have the right to fair, efficient, and timely appeals processes and fast appeal processes in certain healthcare settings. You always have the right to get the healthcare you need. You have the right to receive all the information about the plan and its coverage in easy to understand language. And you have the right, of course, to have your personal medical information kept private. Medicare Advantage plans. Medicare Advantage plans are subject to a lot of do's and don'ts when it comes to marketing, advertising, basically. Medicare Advantage plans, unfortunately, are subject to this extensive list of rules for a reason. And that's mainly because when they first became available and basically exploded onto the market several years ago, there was some people out there not necessarily doing their job in a legitimate way. And a lot of people were being enrolled in Advantage plans that shouldn't have been enrolled in Advantage plans, or being misinformed about Advantage plans, or simply being enrolled without their knowledge into Advantage plans. All of that kind of thing has created the need for Medicare to create rules around how Advantage plans are marketed. And so here's a short list of do's and don'ts. I did include, I think, a much longer list of do's and don'ts in the handouts that I emailed you earlier today. Some of the highlights that you need to be aware of just in an everyday setting, things that Advantage plans, their agents and representatives cannot do or approach you in common areas such as parking lots, sidewalks, lobbies, hallways. They cannot just walk up to you and start talking to you about the Advantage plan. They cannot send you unsolicited texts or call you without having some sort of relationship with you first. For example, if you enrolled in one company's Part D plan, and that company also sells Advantage plans, you already have a working relationship with that company, they would be allowed to call or text you. But if you've never had any coverage with a company ever in your entire life, they're not allowed to just cold call you or send you texts. They are allowed to send unsolicited emails as long as that email has an opt-out option at the bottom. And of course, they're always allowed to mail you junk mail through the snail mail. They cannot ever use the term free to describe zero premium plans or reductions in deductibles or cost sharing. There is no such thing as free. Zero premium does not mean free. They cannot require anybody who wants to attend an informational presentation from these plans. They cannot require you to sign anything, a sign-in sheet or anything. They cannot make you put your name and number and contact information on a piece of paper before you can walk in and watch the presentation, because unfortunately they would potentially use that information to solicit you against the rules. And they cannot camp out in medical providers' offices. They cannot camp out in pharmacies. So they cannot just stake a claim in a location that has a captive audience, basically. That is not allowed. Can they have tables set up in Walmart? Yeah, unfortunately. But if they have a table set up in Walmart, they cannot reach out to you. If you walk up to that table and say, what can you tell me about that insurance? They can talk to you, they can give you the spiel, whatever. But if they're sitting at that table and you're just in Walmart shopping and you do not look in their direction, they are not allowed to come up to you and try and entice you to come and talk to them or tell you about the insurance that they're selling. I know it can seem like kind of a gray area because it is, but there can be some very clear distinctions in that regards. Other things they can't do is misrepresent themselves. They cannot suggest that they work for Medicare or anything like that. They cannot conduct marketing at an educational event. So basically, if someone is advertising that they are going to do a Medicare 101 presentation and tell you everything that you need to know about Medicare, and you go to that presentation and basically they're only telling you about the insurance plan that they sell, that is not allowed. If they're going to do a marketing event, their information has to be pretty much as unbiased as my information. However, if you leave that presentation and they have a table set out right outside the door, they can immediately start marketing to you at that table. They cannot provide meals at those events, although they can provide drinks and refreshments. They cannot provide or offer free services with a value greater than $15. And they cannot go door to door, period. I have heard of some people who have managed to get inside of secure senior housing buildings and put flyers on everybody's door at every floor. That is not allowed. They are not allowed to put flyers on your door of your house in your neighborhood. Not allowed. They're not allowed to knock on doors unless you're expecting them because you have an appointment, period. So just some of the things to keep in mind and keep an eye out for. Some things Advantage plans must do, they absolutely must have their marketing materials submitted for review and approval by Medicare, CMS Centers for Medicare and Medicaid Services. They are absolutely required to comply with the do not call registries, for what that's worth. They are required to obtain permission to contact you. So you have to say, let's set an appointment, or you have to agree. If they ask you, do you want to go ahead and set an appointment, talk about this, you have to say yes. And they typically have to get you to sign something that says you agree to that and to the scope of what you're going to talk about. Because even during an appointment, they're limited to what they can talk to you about during that appointment. If they're there to talk to you about an Advantage plan, they are not allowed to also talk to you about a supplement or a drug plan. They can only talk about one product at a time. And again, see the handouts that I emailed you earlier this afternoon for more information. If you want any other information or have any other questions, you're always welcome to contact me after the presentation. Couple things to keep in mind if you are looking at this type of coverage as your primary or first choice. Again, drug coverage is a biggie. If you are looking at Advantage plans, and in particular because it may include Part D coverage at no extra cost, please make sure that your specific drugs are covered by whatever plan you're looking at. We're going to talk about Part D in detail next week, but what you need to know is that every Advantage plan out there has a different list of drugs that they cover. You want to be very sure that you have whatever plan you're talking to, look up every single drug that you take and make sure that it's on their formula. If you have a primary doctor or any doctor that you currently use that you do not want to lose, it might be a good idea to check with that doctor to see what Advantage plans they take versus hoping that whatever plan you enroll in contracts with your doctor. Because if you enroll in a plan that your doctor does not take, you would not be able to see that doctor anymore. If you have a hospital network preference, in Colorado Springs, we have 2 primary networks. Some people have had very distinct opinions about one network over the other in the past. If that is the case, you want to make sure you know which hospital network your plan requires that you use. If you doctor a lot, it might be important to understand If you enroll in an HMO and you're required to get a referral from your primary doctor every time you need to see a specialist, that might end up costing you a little bit more in copays. And then anything else that you might need to know about that particular type of plan that you're looking at enrolling in. I did include a handout in the email I sent earlier that kind of goes over all of these different types of plans, just like the supplement handout did, just brief paragraphs about each, pros and cons. So it's a nice handout to have. This handout, the second handout, provides a list of all the Advantage plans specifically in El Paso County for 2021. I had a wonderful volunteer who was most amazing and put this together for me. Unfortunately, I've lost her, so I can't guarantee that this kind of handout will be available for next open enrollment, but I'm going to try. But this lists all the Advantage plans available in El Paso County alone, tells you what kind of plan it is, whether or not there's a premium, what typical co-pays are for the most common services, so on and so forth. It's a very nice side-by-side or at a glance handout for you to compare all the different Advantage plans available in El Paso County. I do also have one for Teller County, but I only have those two counties right now. If you'd like a Teller County one, again, just email me and I'd be happy to email that to you. Briefly, I'll talk about Medicare savings programs. This is a federal program that provides financial assistance to people who have limited or low incomes that helps cover the cost of their Medicare Part B premium. There are 3 different levels of assistance based on income and asset levels. Highest income level that you can still qualify for some sort of assistance would be for a single person, $1,496 in pre-deduction dollars, gross dollars, with asset limit of about $9,500. That's the highest income someone can have to qualify for this program. At the lowest income limit, not only would you qualify to have the state of Colorado pay your Part B premium so that it is not deducted from your Social Security, but it would also act as a supplement and pay all your Medicare Part B co-insurances and your deductibles for Medicare. If anybody wants any additional information about these programs, we do assist with these applications, and I'm happy to talk to you one-on-one. Just shoot me an email. And that's it. Again, I do apologize for going over the time limit. I appreciate your patience. I hope this was useful information. I'm going to address some last questions before I let you all go, because I know it's been a long evening. Okay, so first question is, if I see an ad for something that says Medicare approved, should my Advantage plan pay for that item or procedure? That's kind of a sticky. An advertisement that says Medicare approved something is probably the first clue that it's no guarantee. In order for Medicare to pay for something, so there's a difference between what Medicare covers and whether or not Medicare will cover it. There are many things Medicare pays for, but it becomes your doctor's responsibility to tell Medicare that it was medically necessary so that they will pay for it. So just because you see something that says Medicare approved does not mean Medicare Advantage plans or even original Medicare will pay for it in your situation. Can I use GoodRx in lieu of a Part D plan? Again, we're going to talk about Part D in a lot more detail next week. In the past, you would not have been able to have a Part D and use something like GoodRx at the same time. If you choose to use something like GoodRx instead of purchasing a Part D plan or having a Part D plan somehow, you are allowed to do that. Nothing says you have to enroll in Part D. Nothing says you have to enroll in any part of Medicare. However, if for some reason down the road you needed a Part D for some reason, you would be able to enroll in a Part D during an annual enrollment period. But because you didn't have a Part D prior, and GoodRx is not considered a credible drug plan, it's a discount program, When you enroll in Part D down the road, you're going to pay more in the form of penalties for late enrollment. So you can use GoodRx instead of a Part D. Nothing says you have to enroll in a Part D, but it's not going to be considered a good reason for not enrolling in Part D if you want to enroll or need to enroll in Part D later. So hopefully that answers your question. If you have a Part D, but you find that through GoodRx you can get a better price on something specific, today you are allowed to do that. So you could have both and use both. You either use the Part D or the GoodRx. You can't use them at the same time, but you would be allowed to do that these days. In the past, that wasn't allowed either. Next question is the Medicare savings account the same as my health savings account? Technically don't. They're very similar. They work very similar. Again, there are none available for purchase in the state of Colorado right now, but they work very similar. A Medicare savings account works the same way as a health savings account. But keep in mind, if you have a health savings account, you cannot contribute to that health savings account within 6 months of enrolling in Medicare because there are tax penalty implications of some sort. I don't get into the tax side of that. And you're allowed to continue to use the funds in that account for qualified expenses. But again, you can't continue to contribute to that once you enroll in Medicare. And that's why they came out with Medicare savings accounts that you would be able to contribute to if you had the option to purchase one. If you move to another state that does have companies selling Medicare savings accounts, you could enroll in one. I don't think you can transfer funds from one to another. But again, they're going to work very similar, but they are not the same thing. Let's see. And then just a thank you. I appreciate that. And again, I appreciate your patience for hanging in there with me tonight. I know we went over time. I hope it was worth it. I hope the information was worth it. I do want to mention that, again, these presentations are in partnership with the Pikes Peak Library District. We've partnered with them for several years now. We absolutely love working with the library district, and hopefully that's where you heard about these presentations. Again, if you have any questions or concerns, or if there's anything that you would like to talk about, or if you would like to schedule an appointment with one of our counselors here locally, give us a call or shoot me an email. We're happy to talk to you one-on-one. We are currently taking in-person appointments unless something changes in the near future. We do require face masks, but we are able to set in-person appointments. We can also still do appointments by Zoom or over the phone. Happy to talk to you one-on-one about any or all of these topics or your specific situation. Shoot me an email, give us a call. We're always available. And that is it. So unless there are more questions, I am going to let you guys go for the evening. I do appreciate you guys hanging in there. I'm glad it was worth it. Please contact us if you have questions. Otherwise, hopefully I will see you all next week for Part D. And I'll try very, very hard not to go over the hour. But otherwise, don't forget that this presentation has been recorded. It will be posted to our website within a few days, as well as the handouts that I emailed will be available for download from the website as well. Otherwise, I'm going to let you guys go. Thank you again and have a good night, and we'll see you next week.